What are the treatment options for fetal heartbeat absence?
Hello and welcome to this informative session. Today, we are going to be discussing a sensitive topic, the absence of a fetal heartbeat. This is a situation that many prospective parents fear. We will delve into the causes, the diagnostic processes, and most importantly, the available treatment options. Remember that while this discussion aims to provide general guidance, each situation is unique and it's essential to consult with your healthcare provider for personalized advice.
What does fetal heartbeat absence mean?
When we talk about the absence of a fetal heartbeat, we're referring to a situation where a doctor or healthcare provider cannot detect a heartbeat during an ultrasound scan. This usually happens around the 6 to 7 week mark of pregnancy when the heartbeat should typically become detectable. Not finding a heartbeat may indicate a pregnancy loss, which can be heartbreaking. However, it can sometimes also mean that the fetus is not as far along as initially estimated.
How is fetal heartbeat absence diagnosed?
To diagnose the absence of a fetal heartbeat, healthcare providers typically use ultrasound scans. A transvaginal ultrasound, which is an internal scan, can often detect a heartbeat early in the pregnancy, around the 6-week mark. An abdominal ultrasound, which is conducted over the belly, can typically detect a heartbeat a bit later, around 7 weeks. If no heartbeat is detected, your healthcare provider might repeat the ultrasound after a week to confirm.
What are the treatment options for fetal heartbeat absence?
If an absence of a fetal heartbeat is confirmed and the pregnancy is deemed non-viable, there are generally 3 treatment options. 1. Expectant management. This is the process of waiting for the miscarriage to occur naturally without medical intervention. It can take a few weeks, but it allows the body to handle the situation on its own. 2. Medical management. Here, medication is used to stimulate the uterus to expel the pregnancy tissue. Misoprostol is a commonly used drug for this. 3. Surgical management. Also known as a dilation and curettage, D&C. This surgical procedure is used to remove pregnancy tissue from the uterus. It's important to note that the best course of action depends on the individual's physical health, emotional well-being, and personal preference.
How to cope with the emotional impact?
Losing a pregnancy can be emotionally devastating. It's crucial to remember that you're not alone and it's not your fault. Seek support from family, friends, or professional counseling if necessary. Also, consider joining a support group for individuals who have experienced similar losses. Remember, it's okay to grieve and it's okay to ask for help. We hope this video has provided some clarity on the difficult topic of fetal heartbeat absence and the available treatment options. It's a challenging time, but with the right information and support, you can navigate through it. Always consult with your healthcare provider to discuss the best course of action for you. Thank you for watching and take care.